Welcome to the top 10 tips and tricks to have an efficient medical visit for primary care providers. These tips are from Dr. Teresa Fralix, Faculty of the Year Award winner at Hendersonville Rural Family Medicine Residency Program. An efficient visit starts before you even step in the patient room. Tip 1 is to research the patient's previous visits, labs, and imaging, and their appointment note before stepping in the room. Then start with something like, "I understand you're here to go over your lab work," or "It sounds like you've had a cough and fever for 2 weeks. What brings you in today?" is a great way to dig yourself a hole. Tip 2. Order matters. Get the patient into the habit of answering in a bullet point format, or yes and no questions, so that their HPI will be more concise. Start with previous surgical history, for example, and then work your way through family history, social history, and then finally previous medical history and HPI. Tip 3. Once in the HPI, this is your chance to ask open-ended questions and let the patient do most of the talking. They'll give you 80 to 90% of the relevant history. While you're listening, start thinking about what questions you'll have or what imaging or labs you'll need for the workup. Tip 4. Use your quick texts and make your own quick text for common complaints like UTI, cough, pain, diabetes, and hypertension. Tip 5. Write in a bullet point format, not prose. Spurn excess, write only what is relevant and needed. Tip 6. Set an agenda and don't try to cure 6 diseases in one visit. Try saying, "I want to give that the time it deserves, so I'll have you come back next week and we'll concentrate on only that." Or ask what the 2 to 3 most important things that the patient needs to address that visit. Tip 7. Do your review of systems while you perform your physical exam. This saves a good amount of time. Tip 8. Plan on using half the allotted time to actually be in the patient room. The rest of the visit you'll be researching plans, precepting, and writing your note and instructions. Tip 9. Use the patient instructions to communicate with your medical assistant the plan, any orders, and follow-up date. This is really helpful when they're with another patient, so you can move on to the next room. Tip 10. Document as much as you can while it's still fresh in your mind. Try to finish writing your entire note, refill meds, and place orders all right after the visit. This way you can go home on time as well. This is the Black Bag. We hope you've enjoyed this video and found a few ways to be more efficient in your clinic. You and your patients will appreciate it.